Good day, everyone, and you are welcome to our second video on CHCAGE013, which is work effectively in aged care. If you are just joining, please try to watch the first video. Today we are going to be starting off what is our job role in an aged care or in aged care sector. So the first thing is home care workers. As an home care worker, we are expected to visit some older people during the day to check up on them and help them with their house chores. House chores can include helping them to fold some clothes, helping them to do some cleaning, helping them to assist them with some meal prep, or even listing what they are intending to achieve over the week. Other than that, we visit older people in few times a week to help them with errands such as grocery shopping. Some of them, of course, having put in place their cooking plan for the week, they need some grocery, so we always assist in achieving this particular goal. Another thing is stay in the older person home to provide full-time assistance if they have severe needs. Just as I said earlier, people in the home care setting, there is level of need that associates with this. So if the person you'll be looking after, if they required you being with them 24/7, then there will be need for you, of course, to support them appropriately. So depending on the level of needs and depending on the level of support required, we can provide 24/7 support even in the client's home or in the older person's home. Um, Other than home care, we have residential care worker, that is providing care for older person in a residential facility. This is quite common in Australia as well. Facility group activities for older people to facilitate group activities for older people to help them socialize and exercise. For example, if they are only living in their home, it will be they might not really have that urge to actually socialize. They might say, okay, I'm okay now, I'm happy just being indoor. But in the facility, they have people of like mind, people of like age, that they can share understanding and even do different activities together and help keeping family member updated on the condition of their loved ones is part of our work as a residential care worker. Other than residential care worker, we have community support workers. This of course also fall into our area. These are people that handles social or educational program where other people can participate. If you are community support worker, you can look around your area and identify what is it that your older person likes to do at their leisure time or recreation activities that actually meets their needs, that is appropriate for them. When you are doing this, you need to think about the safety part of it as well. Is it safe for them to be able to actually carry such activities out or not? And this help in promoting healthy activities for an older person, which of course increase their well-being. Nurse support workers, these are a group of professionals that observe health and behavioral changes in older people, and they help in maintaining the medical records associated with people in the community. So we do assist the nurse or registered nurse in providing basic medical procedures such as checking the blood pressure or even checking the blood sugar. Before we carry this out as a support worker or as a care worker, we of course needed to have appropriate training and sign off before we start engaging in such activities. Otherwise, it will be out of our scope. So, nurse support worker also assists. We also assist registered nurse in providing basic medical procedures such as taking oxygen level and temperature reading, and even administering first aid when needed. Don't forget, we working in HK or even in the community, sometimes there will be need for us to administer first aid. So we should, of course, have that training in order to save life. Registered nurse, they provide clinical care for older people. They train and manage nurse support workers like you and I. And of course, they administer medicine and provide end of life care. Uh, these are some of the things that some of the registered nurses do, depending on, of course, the client's level of support. So your scope of practice is the limitation of your role based on your position and training. Try to maintain this level of professionalism and look at your job description in your employee handbook. Check your company policies and procedure regarding your role. And going forward or going beyond your scope of practice can lead to negative consequences. So it is advised at all times that we maintain our job description, and in any forms or way we should not go out of our job description. It is important to discuss your role with your supervisor as well in order to have better clarity of what is expected of you, and it also gives you an opportunity to agree on the responsibility that you believe you are capable of doing, and those ones that you are still not fully confident in carrying out. So never assume about your responsibility that you are not qualified to perform. Please always ask questions. In our line of business, we deal with life. So some people might say you are asking stupid questions. Well, don't say it that way, because it's better to ask stupid questions than to make deadly mistake. You are dealing with person's life. You don't want anything that is going to affect someone's life. So ask those questions and get the necessary clarification before you support them accordingly. Delegation means transferring responsibility of tasks to specific person. In each care, the head of care team assigned aspect of customer care to appropriate personnel. If you are in this kind of environment, if they actually allocate or delegate some kind of responsibility to you, before such, they are expected to train that particular worker to ensure they have the qualification or the experience to be able to carry out those tasks. They need to provide an assessment to test their competency. They need to provide support and supervision, and they need to ensure understanding and willingness of that new person that they are intending to give that responsibility to. And lastly, they need to evaluate the worker's performance in that particular role. If anybody or even in any organization, if you are allocated any task, these are the things that you are expected to do, and they expect to, of course, monitor whether you are doing it right or not. If anything is not in the right way, of course, you have your line manager. Reporting line refers to the organization structure. So familiarize yourself with your organization chart in order to know who and who you can count on, or who and you can actually refer to for necessary clarification and support So the organization chart will tell you whom you're reporting to, and it helps you to identify to whom to refer your particular task to. It also helps you to identify who's supposed to support you in any way. So understanding your organization, knowing what is required and how best to support yourself is part of your duty. There's a lot of requirements each care provider must follow. These requirements include the following. One, the legislation and standards set by the government, requirements within the different organization. These two things are just too crucial within any organization because it ensures that we provide the appropriate care to older people. And if peradventure this is not followed, that means the organization is doing the wrong thing that is likely to lead to them having some kind of fine. So here are some of the organizations that connect older person with different care services here in Australia. They will have organizations like Leading Age Services Australia, uh, Older Person Advocacy Network, My Age Care, National Age Care Alliance, Age Care Community Provider, to mention but few. So all these organizations can support in liaising or in connecting aged care people to the necessary support they required. Aged care, of course, involve government paying a lot of money to look after our elderly ones. So, what are those ways by which organizations are funded to be able to provide these services? Um, Residential care provider can apply for grants from government to be able to provide different services or support that they require. They use what we call ACFE, that is Aged Care Funding Instrument, to claim aids for each resident they provide services for. Also, while we are providing and when we are doing what we are doing, we should understand what we call duty of care.